Knowledge with us. Camille has a lot of experience, especially when we talk about the HR world and exposures that we have with human resource management. That's one of her areas. And so again, we're really appreciative to Camille for joining us today, and we'd like to go ahead and turn the time over to her.
Great. I appreciate that. And I am happy to have the opportunity to meet with all of you today. I'm going to share my screen, and let's see if I can get my, here we go. Jason, can you see that?
I can't yet. Sometimes there's one more button. You need to click which you're sharing, and then there'll be an additional button, bottom right-hand corner, I believe.
Let's see. Go back to the Zoom call. Oh, we had this working. There we go. Okay, so you can't see my screen.
Not yet.
Okay, I apologize. Let's see.
No, that's good. We have all become accustomed to Zoom calls.
After you click on which screen you're going to share, on the bottom right-hand corner of that window that pops up is a share button. You need to click again.
Okay, and maybe I thought I had that. Oh goodness. Okay, let me close out of it. Get back to the Zoom call.
Bottom of the screen.
Okay. Let me pull this back up again. Oh, I'm so sorry. We have this working beforehand.
Oh, you're fine.
Okay, so if I do share screen.
And then bottom right-hand corner, share. Aha, there we go.
Did you get it?
There we go.
We got it.
Okay, excellent. I apologize for that glitch. Okay, so I believe that many of you are HR professionals that are on the call today, and my hat's off to you. This has been a challenging several months to try to keep your employees happy and keep them safe and healthy, and so I applaud your efforts. Now you know you've been working really hard at it. The rules have been changing since about mid-March when the Families First Coronavirus Relief Act was passed. We scrambled to try to figure out what that meant for us and for you. And over time, the Department of Labor has issued guidelines. Of course, the CDC's issuing new guidelines. OSHA came out with guidance this morning. So you can see that the landscape has changed, but we're trying to stay on top of it. And I hope to give you some information and at least resources today so that you'll know the right questions to ask so that you can make good choices. The first thing that I wanted to talk about, and can you see that whole slide? I'm assuming you can see the whole slide.
Yes, we can. Sorry.
Yeah.
Okay, I just wanted to make sure, because let's see. I'm going to hide that so that I can see the whole slide that you can see. First thing I wanted to talk about was, of course, the Families First Coronavirus Response Act. For some of you, it became important right out of the chute when it became effective on April 1st, but I think for others of you, it'll become important as employees are called upon to return to work. So I just wanted to go through the parameters of that to start with. Remind you that those leave provisions apply between April 1st and December 31st. I haven't seen anything to suggest otherwise, that is that they would be extended, but that's a possibility that you want to stay in tune with. And of course, it does apply to public employers. So let's go to the next slide here. Generally, and again, I'm just trying to address this in a most general way, covered employers have to provide to all employees, and this is regardless of the duration of time for which they've been employed by you, up to 80 hours or 2 weeks of paid sick leave at their regular rate of pay if the employee is unable to work or telework because they've been quarantined, either pursuant to state or federal order, or because a healthcare professional has told them that they need to be quarantined, or because they're experiencing COVID-19 symptoms and seeking a medical diagnosis. And of course, at the beginning, that was troublesome because it was hard to know even how to get your symptoms treated or where you could be tested, but all of that sort of ironing itself out, and testing's becoming more accessible to people. And so hopefully we have less questions over that. But again, all employees up to 2 weeks of paid leave if they've been quarantined by a healthcare professional or the government's required the quarantine, or if they have symptoms and they're seeking medical diagnosis. The other provision is that they get up to 2 weeks or 80 hours of their paid sick leave at 2/3 of their regular pay if they're unable to work because of the need to care for an individual subject to the quarantine. And that could include someone who's quarantined on the advice of a healthcare professional, or to care for a child who's under 18, whose school or childcare provider is closed for reasons related to COVID-19. And so that impacted a lot of people who did not have childcare arrangements and were homeschooling essentially in these last couple of months until school has, till the school year has been completed. Finally, the Act does provide that a covered employer, and that would include all of our public employers, have to provide an expanded family and medical leave to care for children. But this part, that is this additional 10 weeks, is only for employees that you have employed for at least 30 days. And for those folks, they would be paid 2/3 of their regular rate of pay where they are unable to work or telework due to the need to care for a child whose school or child care provider is closed or unavailable for reasons related to COVID-19. So that's the Families First Coronavirus Response Act. And I think a number of the questions that I had been getting have to do with the documentation that is required for people to submit to you in order to take that kind of leave. So, backing up, just so you know, you'll qualify for a dollar-for-dollar reimbursement of the monies expended for this employee leave through tax credits. So there is some relief there. But documentation of the need for leave is been a question that I've had a lot of people have had a lot of concern over. And so I've pulled out some information from the Department of Labor guidance that I think will be helpful to you. The Department of Labor has said that in order to take this leave, the employee needs to provide a signed statement, and you as an employer need to maintain it, giving the name, the dates for which the leave is requested, what the coronavirus qualifying reason is. So in other words, it could be that my children's school is closed and I'm the caregiver, or it could be that I've been quarantined. And the statement that the employee can't work or telework, and that reason. If there is a quarantine order that they're relying upon, they have to give the name of the state or government entity that issued that quarantine order. Let's see. If an employee is seeking leave because they've self-quarantined, they need to make the name of the healthcare provider making that quarantine recommendation available. And someone who's caring for a person who's been quarantined must likewise provide either the quarantine order issued by the state or the name of the healthcare provider. I think there was a lot of confusion at the beginning about whether or not you needed doctor's notes. And the CDC has said, and the Department of Labor has echoed, this is a challenging time for medical care providers to provide a whole host of documentation. And so you may need to have just a note that's stamped. You don't necessarily have to have some kind of personalized note from the doctor to qualify. With respect to someone who's taking the expanded family and medical leave to care for a child, they need to give the name of the child being cared for, the name of the school or the child care provider that became unavailable. And also, and I think this is important, a statement representing that no other person is available to care for the child. So the notion here isn't that we can't have two parents home and both of them on paid family and medical, expanded family and medical leave. But the notion here is that, that you are the person that has to care for the child and can't work or telework. And so you would be entitled to that leave. And again, it's 2/3 of pay for that additional 10 weeks. The first 2 weeks would be paid at the regular rate of pay, up to 80 hours. The Department of Labor has also said that if an employee has a serious health condition related to coronavirus and the need to care for a spouse or a family member, then you can employ your normal FMLA certification to gather that information about the serious health condition. And of course, an employee could take up to 12 weeks if a serious health condition ensues. But remember that the FMLA may or may not be paid depending upon if the employee has any paid leave available to them. Importantly, if the employee doesn't give you proper notice, you should give the employee another opportunity to provide that notice before denying the request for the leave. I think that everything I'm reading suggests that we should err on the side of giving people a second opportunity to fix their mistakes during this particular time, especially since it's a bit of a moving target for all of us. Okay, let me go back to that. Any questions that I need to answer now related to Families First Coronavirus Relief Act or the need for the documentation that would be required in order to take that leave?
Let's see, I do have one question here. If a person falls under one of the categories to be quarantined, but has regular sick leave, can/should they use that rather than this expanded FMLA leave?
Right. I think it's really up to the employee what they choose to do. An employee may choose to use that because they want to be paid for the full, their full pay as opposed to getting just 2/3. Mm-hmm. So you may want to discuss that with the employee and see what their preference is. On the other hand, they may not want to use the sick leave.
Okay, that's the question that we have. We did have a request. Is Camille, could you go to presentation mode so it will fill the screen? We had a request so they could see that just down at the bottom.
Let's see.
That little plus and minus just to the left of that, just that. Go over just a little bit to the right.
Plus minus presentation mode.
Should be able to click on that.
Oh, goodness. Is this on the Zoom panel? Is that what you're?
Nope. It should be on your PowerPoint.
Oh, okay. Let me get rid of this thumbnail, and then I can see presentation mode. Oh, I'm sorry.
Sorry, I just right there on the, if you can go to the bottom of your PowerPoint window. Yep, just to the left and where that plus and minus is, right hand corner. Yes, that's on that one right.
There we go. Is that better?
It's a little better. Now we got the present. We're going to move ahead.
We're
We got
seeing the presenter
mode.
screen. Yeah.
Yeah.
Tell me again.
Let's
Can you
go-
see it?
We'd have
Can
to
you
go
see it
back
now?
and share a different screen.
Yeah, I think we'll be fine right there. Let's see. We did have another question. If an employee has possibly been exposed by another employee, are they eligible to use the federal paid leave?
Well, I think that they may be quarantined by virtue of the fact that they've been exposed. So again, I think you're not going to want that person in your workplace. And so you may want to have them stay home and make that leave available to them. And they may be quarantined by virtue of the fact that their healthcare professional says you need to stay in as well.
Okay. And we did have another comment. Kathy says, I was under the impression that political subdivisions would not be reimbursed for the FFCRA. Did that change, or has it always been reimbursable?
It could be. I haven't looked into that specifically. So what the Families First Coronavirus Relief Act says is that there will be an offset for the cost associated with it. But it may be the case that where you're not making that those quarterly payments, that you're not getting paid. I don't know the answer to that question.
Okay. Thank you.
Okay. Anything else?
I wonder if we could, what do you think, Doug? Do we just need to have her share? Do you have two screens, Camille?
I've got it on my laptop now.
I'm just wondering if you have two screens, because it's showing the presenter screen. You could share the opposite screen, and then it would give us a full screen.
Let me close it and see. Did that make a difference?
Okay, so we went back to where we were. Now, if you would go to your share screen.
Let's do full. Nope, that didn't work.
Go to your.
Is that any better?
It's just showing the presenter screen instead of the full screen. If you have two screens that you're using, go down to the bottom in the Zoom window where it says share screen, or actually it might be on the top for you now.
Yeah. Okay.
And share the opposite screen.
Okay. Let me do stop share and get back to where I was. Yep. Okay. Now I'm going to do share screen.
And it'll be the opposite one that you did, where it gives you the option to do the two different desktops.
Okay. It's going to give me, let's see. Okay, is that any better?
Now do your presentation mode.
And slideshow.
Do your slideshow. We didn't get it. We're going to go forward.
Sorry.
No, that's fine. That's fine.
Okay.
I did have one other question here, if I can pull it up, that would probably be good to hit before we move on. Okay. Is COVID eligibility like FMLA? Our employees aren't eligible because we have less than 50 employees?
We think the answer to that question is that this leave applies to anyone to public employers. But I agree with you that we take the position under family and medical leave that if you don't have 50, then you're not an eligible employer. But the way it reads, it says that public employers are covered by this. So I think you should say you should consider yourself an eligible employer and that your employees would be eligible as well. But again, there's no case law that's developing on this kind of thing just yet. And I haven't seen any guidance to suggest one way or another. There are provisions that allow for exceptions for those that have less than 50 employees. if in offering this leave, it would essentially you'd run the risk of the business collapsing because you're so small. That's not going to hold weight with respect to a political subdivision. So I think we have to assume that it applies. Even though you may be an eligible employer, but you don't have eligible employees entitled to this under the Family and Medical Leave, the Families First Coronavirus Relief Act does say it applies to, political subdivisions, to public employers. And the exception for under 50 means that your business viability has to be challenged by virtue of the COVID-19.
Great, thank you.
Okay. Is that screen better? Can you see the slides?
Yeah. Well,
okay.
It's great. We'll
okay. So I wanted to talk a little bit about returning to work now, and I wanted to just address OSHA. So OSHA just issued guidance about 5 or 6 hours ago about what needs to be reported if you do have somebody diagnosed with COVID-19 in your workplace. And there are certain provisions under which you do have to report it if it's clear that the exposure came at work. But I haven't had a chance to study those in great depth. I just saw that it came out first thing this morning. The OSHA Act, though, and this is critically important, requires that you provide a workplace free from recognized hazards that are causing or likely to cause death or serious physical harm to employees. The OSHA does not require a workplace in which nothing bad ever happens, right? And so I think a lot of people are really concerned about what can they do to make sure that they don't get any COVID-19 in their workplace. And the answer is you're going to do everything you possibly can based upon the science that's available to us, but you don't have to have a perfectly safe workplace. OSHA's not going to require that. So OSHA has issued guidance on preparing the workplace for COVID-19. And I've given you the link there to those publications. The guidance does suggest that employers design an infectious disease preparedness and response plan, and that will guide your actions. But again, these are recommendations from OSHA, and it also does describe some things that will be mandatory, but for the most part, these are guidelines. Given the fluid nature of the disease and its diagnosis and its treatment, the plan that OSHA is suggesting you prepare is going to have to be flexible. And so I've kind of identified the things that I think you'd want to include in your plan, and also sort of a step-by-step approach that you might take to the plan. So in developing your return to workplace plan, here's kind of what I'm suggesting. First, you need to assess the level of risk. And part of this has to do with how your workers will be exposed. So in some areas, there's a lot of interaction with the public, in which case there's going to be more exposure. And you've got other people that have very little interaction with the public, so the exposure goes down. Some of your populations may have interaction with international visitors. Some of your workers will be dealing with the public on a regular day-to-day basis, and others won't ever see them. And so I think you need to assess the level of risk, and remember that what works in one part of your workplace may be different from what you need to do in another part of your workplace. The other thing that you'll want to take a look at when you assess the level of risk is your workers' individual risk factors. So the CDC has said that people who are 65 and older, those that have chronic lung conditions or moderate to severe asthma, people with serious health conditions, and people who are immunocompromised, or people with severe obesity with a BMI of greater than 40 are considered high risk. And so if you've got a population of employees that are high risk, there may be additional precautions that you take based upon your employee population. So two sides to it. You look at your employee population, and then you look at who they're exposed to in the workplace when you make these decisions. And then the second thing I think you're going to want to do is just implement these basic infection prevention measures. And these are all from OSHA, okay? So these are steps that OSHA says all workplaces can take to reduce the risk of COVID-19. And I encourage you to implement all of these. Of course, we're going to encourage workers to stay home if they're sick. We'll talk a little bit later about what you want to do to find out if they're sick. You're going to, talk about respiratory etiquette, covering coughs and sneezes. And there's lots of ways you can do this. You can send email with these kinds of reminders. You can do posters for people who've returned to the workplace. Number 3 is important. That is, you've got to have places to wash hands. And to the extent you don't have soap and water, you're going to want to have the alcohol-based hand rubs, the hand sanitizers. I know that at the beginning, one of the challenges was sourcing this kind of stuff. And so you're going to want to make sure as you return people to the workplace that you've got sufficient soap, you've got sufficient hand sanitizer. The next step that the OSHA has suggested is to limit work site access to only essential people. And I think you probably want to consider whether you're going to limit not just work site access, but also to your workers, but also visitors. Consider who you're going to allow come in and the frequency with which people will be allowed and those kinds of things. Flexible work sites, flexible work hours if feasible. We're going to discourage our workers from using other people's phones or their desks or other work tools. And if part of your workplace includes an area where people have to share workspaces, then you're going to want to develop a plan for cleaning the workspace, when people leave the workspace and then when someone else comes into that workspace. Regularly cleaning and disinfecting services, equipment, and other elements of the work environments listed here. I think one of the challenges is that the cleaning people that we've relied upon for years to come in and clean our workspaces were more, they've been hired to vacuum and dust. And I guess I speak from personal experience just in the law firm. And then they swished, some cleaner around in the toilets and the bathrooms, but I don't think they were tasked with disinfecting things. And so in our workplace, in the law firm, we've actually retained someone now. We've hired someone whose job is to disinfect contact surfaces. So that's one way that you can deal with it is either contacting your cleaning people to make sure that they understand now a new responsibility to disinfect, or to hire somebody to do that, because I think that's going to be important. Talks about the use of EPA approved cleaning chemicals and following the instructions, and then encouraging workers to report any safety or health concerns as well, so that we get a better handle on what's happening in the workplace. And again, I think as we return people to work, we're going to have a better gauge for how things are going, the frequency with which people are assembling, and whether or not we can source the materials we need to keep things clean and disinfected. The state of Utah has also made some general recommendations for all workplaces. And these are intended to protect high-risk employees. So the people I talked about before that are immunocompromised or over 65. But I think it's worth me just mentioning some of these to you so that you understand the kinds of recommendations that could come into play for high-risk employees. Of course, high-risk employees, if it's feasible to allow them to work from home, that's certainly maybe the best way to do that. The other suggestion is that all individuals wear face coverings when they're in public spaces. And I think if you're going to require employees to wear face coverings, then you're going to want to provide them, or you may choose to provide some reimbursement for them. If it's voluntary, then I think it's a little bit different. But if you're going to require it of them in the workplace, I think you're going to need to provide it for them, or you can't require them to do it and then not provide the masks for them. Of course, another one that they've talked about is wearing disposable gloves when interacting with the public. This again comes from the state of Utah guidelines and recommendations for protecting high-risk employees. And again, if you're going to make use of those, you're going to have to source those kinds of materials and make sure you have access to them. One of the other things that the state of Utah suggested is screening both symptomatic and asymptomatic workers by taking their temperatures, and we'll talk a little bit more about that. Plexiglass barriers are another way that you can protect high-risk employees. You can also look into your air ventilation systems. There's certain HEPA filters that you can use in your HVAC systems that may help dilute the air. And there's air purification systems. Again, this all comes from the state of Utah. I'm not trying to sell you anything, but they say that you may consider those air purifiers for small spaces as well. If you can avoid handling cash, do that. And that may or may not be possible in your workplaces. Common areas like restrooms and break rooms and kitchens, you're going to want to pay special attention to in terms of keeping them clean. And you may want to designate areas for high-risk employees to be used only by them, a bathroom that's cleaned more regularly or something like that. And then you may, if you've got elevators, you may want to come up with a plan with respect to use of elevators so you don't have groups in elevators. So that's just kind of a run through of the recommendations that the state of Utah has made to protect high-risk employees, but ideas that you may implement as you work to keep your employees safe. And again, I don't want anyone to feel like OSHA is going to come down after you if somebody gets sick in your workplace. I don't think their efforts are meant to penalize for someone, but I do think you have to take every possible precaution to try to protect your workforce. Okay, so the next thing I think you want to do with respect to returning to work is implement workplace controls. And the way you're going to do that is by preparing the building and the work site, and you're also going to prepare the workforce. You're going to control access, and you're going to create a social distancing plan. So in terms of preparing the building or the work site, again, you can look at the HVAC and mechanical checks if necessary. Make sure that your air ventilation systems are working well. Increase ventilation in work areas if possible. Address common employee areas before people return to work. For example, in our law firm, they just took all the tables and chairs out of our break room. It's a room that has a coffee maker and a refrigerator that people use, but we don't want people assembling there to eat or to share food. And so that space has just kind of been changed so that people aren't assembling there. And you've got to come up with rules with respect to things like your kitchen and your break room. Are you going to allow people to bring food into the workplace to share? Or are you just going to say, don't do that right now? Anything like that that brings people together, I guess, presents a bit of a challenge. And then you've got to think about who's going to clean those common spaces during the day. You may want to come up with a plan for creating social distancing in restrooms as well, so that you don't have as many people in the restroom at one time. You can modify workspaces to keep people at a distance of 6 feet. That may mean moving some desks around. It may mean these plexiglass barriers that have been suggested. Another option is to keep people safe is to have those automatic doors installed so that people don't have to touch doorknobs, or to prop doors open in common spaces so there's not all that touching. The next area that I have here is preparing the workforce. And I guess I think this is as important as anything. You can do lots and lots of cleaning, but addressing people's concerns is going to be really important. And so the first part, I think, is to mitigate their anxiety. You are going to have employees that are concerned about coming back to work. I think it'll be important for them to know the efforts that you've made to clean the work site and the efforts that you're making to keep the work site clean. So that's important to address that. You should consider whether or not you want to have a schedule for returning employees. And if you are going to phase people back over time, that's fine, but you just need to make sure you're using legitimate, non-discriminatory criteria for this determination as you make decisions about who's coming back. And you may choose to do an A day and a B day where people come back over, they're alternating days that they're in the workplace, so you don't have as many people there. You may choose to have certain groups of people come in, or certain departments come in, and change that over time as well. I think you're just going to have to be creative there. The other thing you can do is change up your start times. If you don't want to have everybody coming in at the same time, you can do start times where people come in over the course of an hour every 10 minutes, so that you don't have so many people in and out at the same time. You're going to need to be prepared to deal with their requests to use the paid time off or to take leave under the Families First Coronavirus Response Act. And we talked about that, so I think you're prepared to do that. I think it's really important that you have a plan for dealing with sick employees, and this kind of came up already. Or what you're going to do if there's an infection of somebody with whom your employee lives. And I guess I would say let's continue to follow the CDC recommendations. You're going to want to make sure that if an employee has COVID-19 symptoms, that they let their supervisor know and they stay home. We don't want them to come to work at all. So if they think they're sick, they should stay home. And if they're seeking that medical attention and they have COVID-19 symptoms, then they would be entitled to that leave. But there may be other situations where they don't have COVID-19 symptoms, but they're sick. We want everybody who's sick to stay home, and those people could make use of their sick leave. There's CDC recommended precautions about having a family member that's homesick. And my take on it is, caution is key. And so if you've got a sick family member and have potentially been exposed, we'd rather have that employee stay home until we know that it's not a COVID-19 exposure. If you have somebody arrive at work sick, my suggestion is that you get them out of there ASAP. And certainly as fast as possible, separate them from other employees and from people that are patrons that are coming into the city, and get that person sent home. And then of course, if you have somebody that's confirmed to have COVID-19 exposure, it is important that if you have that information as an employer, you still maintain the privacy of that information. You don't want to disseminate in your workplace who's got COVID-19. So what you're going to do is just simply say we've had a COVID-19 exposure or a positive, and these are the steps we're taking to protect all of our employees. And you could certainly tell an employee, and I'd recommend it, that they had been exposed to someone who tested positive. But again, you should not be sharing the name of the employee. So that's all kind of part of having a plan to deal with sick employees. And of course, if you have had a sick employee, a COVID-19 positive employee in your workplace, you'll need to take some steps to make sure that the workplace is clean before returning people there. The personal protective equipment, again, as I mentioned before, you can certainly require people to use face coverings when they're in public spaces. And if you do that, you'll want to make them available. At a minimum, you can encourage people to do that. And then you need to make decisions about whether or not you're going to require people entering the workplace. So visitors or somebody that's coming in to pay their power bill or whatever, do they have to wear a mask? And then consider if there are places where using gloves would be useful. And again, flexibility is key, because when this all started, remember, we were thinking, well, they were telling us that masks weren't that important. And now you have to have a mask to get into Costco. So it's changing. And so you're going to have to just be flexible with respect to some of these return to workplace measures. Temperature taking is an interesting idea. So normally any kind of medical exam like that would create some risk to an employer under the Americans with Disabilities Act, unless you had a legitimate reason to request the testing. And the EEOC has come out and said that under the Americans with Disabilities Act, temperature taking of your employees is okay. That's guidance that's come out from the EEOC. But again, the information that you glean from the temperature taking is private, and you've got to keep it separate from your employee's personnel record. It's going to be kept with your employee's health records that are separate. And you would have an obligation to keep that information if you're doing scanning of all your employees. And then you've got to figure out what to do with it. So I'm not trying to discourage you from doing the temperature taking if you believe it would be useful, but you've got to be mindful of the steps you need to take in order to keep that information confidential. If you're going to do temperature taking, just know that it's paid. If somebody's waiting to be temperature tested, that would be work time that they would be compensated for. So consider that, consider the temperature taking, but know that there's some responsibility that comes with that. The next part of this implementing workplace controls is controlling access. And again, visitor policies, who can come in, who can come out, do they have to wear a face mask? You need to think about who's going to be receiving these people when they come in. Are there going to be doors locked, or are the doors going to be open? Think about shipping and receiving as well. Your FedEx or UPS people coming and going, your postal people, how are you going to receive packages? How are those packages going to be dealt with? How are they going to be delivered to the recipient? And to the extent that you've got employees traveling, you may want to address kind of a travel policy. If someone's leaving the country, there may be a quarantine that's required depending upon where they've traveled to. So you want to think about that as well. The next part, let's see, we'll go back, creating a social distancing plan. So again, this is so workplace specific. You've got to think about where do people congregate and try to decrease the density in those places. consider, office traffic patterns, and consider video conferencing even in the office so that people aren't assembling if there's a way to do video conference. You could change hours of operation a little bit. So rather than the AB day that I talked about, you could have an early shift and then a late shift. So people are still putting in their hours, but they're doing them sort of on alternating shifts. And depending upon the work of the employee, consider some of the work being done at home and some of it being in the workplace. If you have to meet in person, you're just going to want to space your chairs 6 feet apart. And I participated in a meeting yesterday around a very big conference table, and all of us wore masks and all of us were 6 feet apart. And to the extent someone needed to speak, they just removed their mask briefly, and it worked okay. I think everybody's having to be a bit flexible. And then the last part of this return to work idea is just keeping the lines of communication open with your employees. I think we're going to learn a lot of lessons as people re-enter the workplace of what's working and what's not working. And it's just really important that you be flexible in adjusting, what you're doing. And this will be flexible in adjusting to your employees, but also importantly, adjusting to the new and additional information that's coming out about how we can best protect ourselves. So with that, let me just kind of open it up to questions. And we can talk about whatever you want with respect to this returning to work or anything else. I wanted to make sure you were aware of a couple of resources. So there's the Protecting High-Risk Individuals that the state of Utah has issued. The CDC it's called Interim Guidance for Businesses and Employers to Plan and Respond to Coronavirus Disease 2019. So the CDC guidelines are available and helpful to you. And then, as I mentioned earlier, the EEOC has come up with some guidance about the ADA and and returning people to work. Maybe let me just address that before we open it up to questions, because there may be some issues there. And I'm just going to read to you what the ADA or the EEOC has said. It says the ADA, the Americans with Disabilities Act, permits employers to make disability-related inquiries and conduct medical exams if job-related and consistent with business necessity. This inquiries and reliable medical exams meet this standard if it's necessary to exclude employees with a medical condition that would pose a direct threat to health or safety. So I think some of the questions that I'm getting have to do with how much you can ask about an employee who wants to come back to work, or sometimes who doesn't want to come back to work. And the long and short of it is that your inquiries that are business, job related and consistent with business necessity to keep your workplace safe are going to be allowed. So maybe that helps. Questions?
Yeah, folks, if you type your questions into the chat box, we'll answer those at this time. Just to go along with what you just talked about. So in the case, so let's say we have a COVID-19 positive case. One of our employees gets sick and they're quarantined, they're out for 2 weeks, and they want to come back to work.
Yeah.
At that time, what can an employer ask of an employee who has been ill? Can they request proof that, hey, you've got a negative test before allowing them to return to work?
I think what you want to do is and this is an example where I think you do want a medical professional saying that they're cleared to return to work. Where you've got COVID exposure, a positive test. I think if you don't get that, you're going to have all your other workers worried. And the fact of the matter is, we are not to let people know who has COVID-19, but do I think that people are going to know? yes, I'm not so naive as to think people aren't going to know who has it. And so I think it'll be important for people's emotional well-being to know that this person's been cleared to return.
Yeah, great. Great answer there. A couple of questions. Let's see. I've got to make sure I don't miss this one. Are CDC guidelines to quarantine for 14 days upon returning from travel considered a government-issued quarantine for FFCRA?
I would say yes. If somebody's been out of the country and the CDC says they need to stay quarantined, then I'd say yes. I would say that's a government issued quarantine.
Okay. Next question. I haven't got all the way through this one. Let's see. If an employee is asked to go home by the employer, can the employer require them to use their PTO, or do you have to pay them administrative leave until they can see a doctor?
I don't think you need to pay them I don't think you need to put them on a paid administrative leave. That's the reason why you have sick leave available to employees. And if they don't have paid time off, and if they have COVID-19 symptoms and are seeking a medical diagnosis, they'd be entitled to the leave. I don't think there's going to be very many people that don't get paid to be off, either because they have their own sick leave or because they're seeking medical attention. But potentially, I guess there's the potential there that we send somebody home and they don't have any paid sick leave yet, and they say, I'm not going to go see a doctor, then they're not going to fall in that category, and it may be unpaid leave. But we just can't have sick people in the workplace. And given this present state of affairs, I'm okay defending that claim, right?
Mm-hmm. Yeah, great. Looks like we've covered most of the questions. There was a question if we'll be sending out a link to this. Yes, we're recording the session. It's actually on our YouTube channel, going live right now. So if you did happen to come in late, you can go back and review the information that Camille shared with us today. That looks like all of the questions that I'm seeing coming in. We do have Doug.
Yeah, Jason, I had a question come in here. What if the employee's child is displaying symptoms? Do we offer FFCRA while the child is tested?
I think so, because you've got somebody with you can't. I think yes, because you're caring for the child. If you're the primary caregiver for the child, I think so. That's my gut reaction.
Yeah. All right. Let's see.
We're erring on the side of giving folks the benefit of the doubt under these circumstances.
Yeah. You know, one thing I was thinking, Camille, as you were talking about making our modifications to our work schedules and things like that, the thing that keeps coming into my mind is asking ourselves the question: has working from home been effective? You know, is there an imperative need to get that person back to work, or if it's effective to have them work at home, why not allow that to continue on and minimize the amount of exposure we have until we move down the road, and like you mentioned, staged have a plan to bring these people back on if it's working.
Yeah, and again, I'll be honest with you, I foresee that as creating there's a silver lining in all of that, because we're learning that we can work from home. But I also know that many of your job descriptions say that an essential function of the job is working in the workplace, right? Mm-hmm. And now we're going to have employees say to us, well, it's not essential. I worked for 6 weeks from home and everything went just fine. So I know we're going to have some challenges in the future about whether or not working in the workplace is an essential function. And so I'll just let's get in front of that. If it's a job that does require an employee to be in the workplace, make sure your job description just says that as an essential function, because I think we're going to have more and more people saying, I can do this job from home. And if it's not a job that can be, in the case of a pandemic, for a few weeks, maybe. But if it really is a job that requires somebody to be in the office or interfacing with the public, make sure that your job description says that. Otherwise, we're going to have lots of fights over whether or not that would be a reasonable accommodation for a disability to allow someone to work from home.
Very good point. Very good point. Well, great. Thank you so much for taking the time to put this presentation together and for presenting it to our group here today. And thank you for the questions to those who have submitted those questions. I believe we've covered every question that we had there. Final word?
It's a pleasure to be with you. Good luck navigating all of this.
Thanks so much, Camille. Appreciate all of your efforts there, folks. Thanks for tuning in. Like I said, we did record this session, and it should be live on our YouTube. It's live on our YouTube channel. It'll go up there as a permanent fixture here within about an hour as it renders. Thank you so much once again. Be safe out there, and we'll talk to you again real soon.
Okay.
Thanks,
Bye.
guys.